I think we can start the first scientific session that will be coordinated by the Professor Gianni Pellicanò. He is a neuroradiologist in the one big hospital in Florence. He was president of our association, Italian Association for Telemedicine in Medical Informatics, and now Professor Pellicanò is the coordinator of a scientific committee of our association in Italy. Please, Gianni Pellicanò, for your speech and coordinate this session. Very, very important session. Telemedicine in the emergency. What we can do in this cooperation, in this situation.
Thank you. Thank you very much, Francesco. And first of all, I need also to say yes to say thank you to Francesco for the organization of the meeting. Can you see my my screen?
Yes. No.
I try to enlarge.
Okay, enlarge.
Okay. So first of all, I would like to thank Francesco for the organization and the other colleagues, and I want to start with a warm welcome to our Ukrainian colleagues. When we organized this Congress, we tried to contact our Italian health minister that sent us a letter, as you can see here, and he asked for a good meeting and giving us all support for all eventually initiative that we want to take in to help as our Ukrainian colleague. So first of all, I would like to ask to our Ukrainian colleague to correct me if I make some mistake about especially numbers, because numbers are increasing every day. So my numbers are just to give an idea of what we know about this situation. And we want, my outline is to start with the previous health situation in Ukraine, and just to understand just only a few aspects, and to understand how war, of course, create a worse situation in this case, and to share with you the situation, for instance, that the Ukrainian government make a big effort to increase the number of people with vaccinated, you see here. And the problem is now with the COVID situation, because before the war, the rate of vaccination in Ukraine was low, and you understand that all the measures that we need to stop the COVID situation are very difficult to maintain during the siege of this situation. For instance, you know that's clearly impossible to mask wearing, social distancing, basic hygiene, and so on. The many hospitals were damaged or even if also destroyed by the war. So it's very difficult to restore the previous situation. And another really urgent is that the million people that come out of the country and people that are displaced inside the country. So give to this enormous quantity of people the right safe and the right care is very, very difficult. And of course, we know also that during the war, there is the typical post-traumatic stress disorder that we expect that will affect a lot of people. So they need also for the first aid psychological assistance at a professional level. And of course, which is the answer to a lot of the problem that the health system in Ukraine is experimented. Of course, the first answer can be remote. It means telemedicine during this situation. And many Ukrainian doctors intuitively come to this decision. So the first step was that many doctors offer to their patient their activity with simple system as a messenger, as telephones. And also the Ministry of Health in Ukraine announced to offer a call, to call a single number, just to start with something that can help the people. But especially the problem of 1 million internally displaced people, in which way we can are effective to help. So we focus to telemedicine in this case, and many companies offer their own telemedicine platforms, and it means many doctors that give help from different countries as a volunteer. But there are, of course, certain barriers, for instance, the language, because we need to create the platform in which that are friendly to use for the doctors and both for patients. And just an example, for psychological help, it's quite to be obvious that they need to communicate in patient's native language, and are very, very few companies at the moment that can give a user interface in Ukrainian or at last in Russian. Just few examples to explain how the telehealth companies are offering free digital health service. For instance, Vivio Health is based in Estonia and was one of the first that give for free his platform, and not only with desktop form, but also and especially in with app on smartphone. And this company attract doctors from around the world, and of course, particularly those with language capabilities are to serve the people of Ukraine. This is the screen. In this case, you see the part dedicated for people in Ukrainian and for healthcare workers. So these are systems like this one is email. You see the interface in Ukrainian language, contemporaneously also in English. These are very useful, of course. And the same, this is based in Romania. I think that Dopomoa, of course, I asked my Ukrainian colleague to correct me, Dopomoa needs help. And this is to support people moving from Ukraine to Romania, and not only so help for the health, but also for to give documents, to give all the type of assistance. And in this case, I see the interface in Romanian, and there is also in Ukrainian language. This is the support given from a big company from Israel. And the Sheba Hospital is one of the most important hospitals in Israel. And you see that a very simple way to analyze the fetus, the embryo, and with ultrasound connected to a simple smartphone that can so send the images. And the same with other devices. This is in the Israeli company, Care, that has a lot of devices that were given to the through the UNICEF personnel to the people in Ukraine. A lot of telemedicine kits, especially for child. And another platform is this one, that are platforms that already existed before. But this is the part dedicated to the Ukraine telehealth relief. It's a very strong platform that, of course, inform about the tragedy, about the system to call for help. Just two examples about one very important problem. The continuity of care and the adherence to therapies is not a priority during war. Just two examples, of course, oncology. Many patients cannot access their therapy, such as chemotherapy. You know that this therapy must be administered in the hospital, so it's very impossible to these people to access. And at the moment, one of the most important solutions is to transfer this patient. For instance, also in Italy, such as other countries, and also in my county, in my city, in my hospital, we host a lot of child with tumors. The second is diabetes. In this case, patient can access to the therapy directly, but it's difficult to obtain the insulin and the other therapies because they're difficult of send the drugs. For instance, two colleagues from Ukraine published on Lancet a short paper in which they suggest two important solutions. For instance, the uncleaved aircraft system to deliver and distribute the drugs, but of course to create the green corridors to make the drugs arriving to the patient. And but Ukraine is a very, very strong country, is very active. This is the initiative to attract to the Ukraine a lot of IT and technology companies offering a legal and tax special occasion. And this was when this initiative was published, and it was the last part of a long work, very strong work. And you see that this presentation was made February 8 in 2022. It means just a few days before the war was started. So this is only just to remind to the other people, of course, not to our Ukrainian colleagues, that the Ukraine is very active. It's a modern country that wants to create a digital situation, digitalization of most of the activities in the country. But the real situation, you know, is a very, very tragic. And when we speak about telemedicine, we are in front of two big problems. The first one, the difficult to use the infrastructure because all the internet networks can be a difficult situation. Most part of it are destroyed, and this was a solution to use the Starlink satellite system. You see that here people around the device, and they can use their smartphone in the center of the city, in this two small but important city near Kyiv, in which situation they can send a call or a message to their relatives just to inform of their situation and to have notice about that, because the spread of the family is a tragedy inside the tragedy, of course. And this is one of the person that is much more active to digital transformation in Ukraine, and is convinced that, of course, technology is not only the solution, but now we are in front of us not only a military war, but also in a cyber war. So cyber work works better than bullets, he said some days ago. So what is the problem at that level? That we need an infrastructure to make telemedicine work, but we have to pay attention also to the security, because a lot of military initiative in this field. So in conclusion, during wartime condition, we have to pay attention also to security. That's one of the first challenge. And the other situation is, of course, to create a situation with a safer remote location. So we know that, just with a simple example, we have a lot of initiative for Ukraine. It's normal, because we all want to help. But we need also not to have a lot of initiatives, but I think we need also to coordinate, to have an effective action to minimize the consequence of this humanity tragedy. It is for us a new situation that we ever known since the World War II in Europe. And every day we know, we see how this situation changed, and we are not expected, of course, a so largest tragedy. So we need to combine our efforts and direct them to an analysis of the current situation and the development of effective situation to solve the problems. So telemedicine, since the situation of war, can address all the challenges on the ground, but offer an immediate solution when rapidly rising demand in health services collides with healthcare capacity shortage that both are created by conflict. So I think that telehealth maintains continuity of care for refugees, migrants, and internally displaced populations. And I would like to thank you for your attention, and especially to thank our colleague that attend our meeting in a so difficult situation. Thank you. So now we can move to the next speaker. That is Professor Nikolay Bayazitov. Is a medical director of the Odesa Regional Hospital in Ukraine. Thank you, Professor, and good work.
Доброе утро, коллеги. Good morning, colleagues. Спасибо, что пригласили нас на. Thank you for inviting for this meeting. Мы очень тронуты тем вниманием, которое оказывают итальянские коллеги. We're very grateful for your attention. В желании помочь Украине и Одессе в частности. For your attention for helping to Ukraine and Odesa. Телемедицинские технологии помогают нам в решении медицинских проблем. Telemedicine technologies help us to solve medical problems. Однако у нас не хватает ресурсов для использования телемедицинских технологий в полной мере. Unfortunately, we don't have enough resources for using telemedicine in, let's say, full region in whole aspects. И готовясь к этой конференции, мы послали вам нашу просьбу помочь в поддержке и расширении возможностей телемедицинских технологий. And preparing for this conference, we already sent you problem that we have and what we need to solve for starting use telemedicine starting use telemedicine. Мы располагаем хорошим кадровым ресурсом. We have good specialists, technical specialists. И в нашем регионе информатизировано более 100 медицинских учреждений. And in our region, I need to say that is the biggest region in Ukraine, Odesa region. We have already connected to about 100 hospitals in our own Odesa region. И вся или большинство медицинской информации стекается к нам в региональный медицинский центр. And almost all the medical information that we got from the regional hospitals from the region goes to our hospitals, the biggest hospital in Odesa. Особенно широко мы используем телемедицинские технологии при оказании помощи пациентам с инфарктом, инсультом и беременным женщинам. The widely using telemedicine is for the patient with cardiac problems and also for pregnant women. Но ситуация очень непростая, и мы понимаем, что нужно будет внедрять телемедицинские технологии в оказании помощи военным на поле боя.
The situation needs to involve telemedicine also, not for a planned patient or for a patient with a cardiac problem, but also for a patient with injuries because of war, especially war injuries. Also to involve surgery, telemedicine in patients with surgery problems, to consulting them.
Наш госпиталь располагает 1000 больничных коек.
Our hospital, as the biggest one in Odesa region, includes about 1,000 beds for 1,000 patients.
И половину из этих коек мы уже сейчас зарезервировали для оказания помощи.
And half of these beds are for patients with war injuries, for military people.
Конечно, мы были бы очень благодарны, если итальянские коллеги помогли нам цифровым оборудованием.
We would be very grateful if Italian colleagues will help us with technique, with the equipment for telemedicine and connecting us to the worldwide systems of telemedicine.
И я тронут тем желанием помочь нашим пациентам в психологической и физической реабилитации после тяжелых травм, которые, возможно, можно будет использовать итальянские госпитали.
And also, we don't need to forget about the psychological trauma that patient got after the situation and war in Ukraine, and we would be very grateful for helping Italian colleagues for such patients, for consulting them.
Мы очень благодарны за интернациональную поддержку Украины, украинского народа и украинской медицины.
We're very grateful for the international support for Ukraine, Ukrainian people, and especially Ukrainian medicine.
Благодарю за внимание.
Thank you very much for your attention.
Thank you to Professor
Nikolay.
Bayazitov. We want to, is someone that want to ask something to Professor Bayazitov? He told about a list of things that he sent us, and we wanted to share about this. And of course, we will do every effort to our Italian, almost for us, Italian companies and industries to obtain this furniture, this apparel, and we hope to send him to his hospital everything we need. And also, as Professor Bocchicchio told us, we are available to accept students in our university hospital, and to, in case is a good idea, also to have to take a lecture online for the students. Everything we can do, we will do. Okay, so we can, for first another time, thank to Professor Bayazitov for his speech, and it was really very emotional to see and to speak with a colleague in Odesa that many of the things that we know are only war news, and we now see in television terrible things, and for us was a very, for our soul, is very emotional to see him in his hospital, is working, and we hope that he can continue his very fundamental work, especially in this situation. Thank you again. So we can move to the next speaker, is Judita Kinkorova from Pilsen in Czech Republic.
Thank you.
Thank you. Please.
Yes. Thank you, Francesco. Thank you all for organizing this conference, which is very important for both for Ukrainian to know that they have friends, support and help in Europe, and also from hearing from them what they need, what they want, and what they expect from us. Every country has its own specialty. So we heard about the Italian contribution, and I would like to share with you our experience from the University Hospital in Pilsen from the Czech Republic. Starting point, we remember it was also mentioned here that after the Second War, this is the really the first war never could imagine. And from the last century, we as a Czech Republic, maybe you remember the year 1968, where Russian army entered to the Czech Republic, and after 20 years, we changed the system. So we feel very well the situation in Ukraine. The second point is that the Ukrainian language is Slavic language. So we a little bit understand it, and it's easier for Ukrainian people to speak to us. It's for them better than English or German or maybe Italian language. So the first step is a little bit easier. And the third thing I would like to mention that we have more than 30,000 Ukrainian persons in the Czech Republic working here, mainly in supportive employees. So in our hospital, we have, I think, more than 30 Ukrainian supportive persons, which is nice to hear. No, not nice. I know in our department works a lady, she has in Kyiv 2 daughters, 10 and 12, and she was really very sad, and every day she tried to connect to them and to see them, how they can survive. Now, both girls are in Pilsen, so we are very happy that we could help really in person. So when you open web pages of our hospital, you can see, if you don't understand it, you can see colors that are now very popular, blue and yellow, and then you can see hands, how we help. And at the bottom of this picture, you can see info line where 24 hours, 7 days, you can ask for support. Now, I know that you know the European map, but in the red circle, you can see Pilsen region, which is the second biggest region in the Czech Republic. And the University Hospital in Pilsen is the third biggest hospital in the Czech Republic. So we really can offer great help. We started very early, the first week after the war started. So we started with Assistance Center for Help, where people come and ask. We organized emergency committee in our hospital. The first day, they really have calls and conferences every day. And then now we have them 2 times a week to organize the help. And the first help was to open our hospital, especially mothers, small children and elderly. And as it was mentioned here, vaccination in Ukrainian population is not as good as in other European countries. So we have a special point for vaccination of against COVID-19. And we also opened general practitioners for preventive and routine checkup. This was help, the first help that was organized by our region, by our hospital. We also have the supportive activities that are organized by Ministry of Health of the Czech Republic, which is more general. It is first with humanitarian help, So we organized collections not only of money, but especially from health material that was transported to Ukraine. Then we collected and distributed medical products, medical material and necessary devices to Kyiv and to other countries. We also have several info lines for parents with children that are translated to Ukrainian language. And we also coordinate humanitarian collections, because every region, every time, the solidarity in the Czech Republic was really very great, and it was necessary to harmonize them to be more effective, or to be optimal, effective and efficient. In March, it means 2 weeks later, we organized the Ukrainian Point, which is one great building in the center of Pilsen, when there is ambulance 24 hours a day, 7 days a week, as in Italy. We have it for any patient from Ukraine. And what we, especially in health problems, it's good to understand a little bit, but especially as it was mentioned in pregnant women, small children and old people, is necessary to understand well what the problem is, not only with health, but also mental problems and other. So the following healthcare was organized, not only the first healthcare, but following, because as every mother's children and old people suffered not only with health problems, with mental problems, so we continued this healthcare. And what I think is very great and very important, the Czech government pays for every Ukraine refugee health insurance. So they have the healthcare in our country free of charge. Special attention, pregnant women and newborns. We have in our hospital several newborns that were born in our country and in our hospital. As gynecology, dentistry, dermatology, and infection diseases departments, every of these departments have the translator. Again, these are for the most important departments for Ukrainian refugees. And it was also mentioned here that now, I am not sure, but according to the latest numbers, we have 80,000 people from Ukraine in the Czech Republic. This is the second biggest number after Poland, but Poland is much more greater. So the people coming to our country sometimes do not have ID cards, do not have documents, do not have money. So we, in our points at the regional assistance, we applied for them for visa, for immigration visa, time-limited visa, permanent, depends on their relation to the Czech Republic, to their families they have here, or if they have nobody. So, but every person is registered in our country and receive one of these type of visa. Again, together with registration as a person, they are registered for health insurance that is for them free of charge. And we also organize for them social security and welfare system. Humanitarian help and support. They are centers in every bigger town where they can come for food, for drinks, and for clothes. Especially small children need to have new clothes. So we also organize this, and also psychosocial help and support. We were in the beginning of the war, we in the Czech Republic were very surprised how open people were, because they opened their houses, their flats, and even now they are families, they live in 2-3 rooms, and they live together with Ukrainian family, especially mothers with children, appreciate it very much. Also, our hotels and our types of accommodation are open for them and free of charge. And especially every town offers them transport by buses, by trains, by metro free of charge. So they can move, they can do some shopping, they can go to the medical doctor and so on. And all activities are coordinated from local. It means that every region, and as I mentioned, the Pilsen region is the second biggest region in the Czech Republic. So we organized our help at the local and region level, which is coordinated with national level. And of course, our ministries, especially Ministry of Health, Ministry of Education, and of course, Ministry of Army helps very much in coordination and harmonization these steps. And we know that some people want to come back, nobody knows when, and some people want to stay here with us. So for these people, we opened kindergartens, and mothers welcome it very much. And these mothers started, and they are very much seeking for new work, so they started to work, and children are in kindergartens. We also have some limited capacities in basic schools, and every day we have in our TV news this story how small children comes to school, and Czech children open them and speak to them and include them into the team. And also they are, but especially for secondary schools and for university students, it's important to speak our language or English. So we organize special courses to improve and to learn the Czech language, especially for this higher type of schools. And as mentioned, Professor Bayazitov, some numbers of their hospitals. So these are facts of the our university hospital in Pilsen. So it's big hospital with 1,700 or also 800 beds. We have 4,000 and also 500 employees. We have 54 clinics and departments, 25 certified centers. So you can see we really can offer help, and we are happy that can help. So in the end, I will finish with this. It means we help to Ukraine, our support to Ukraine. So I would like to put my name to the list that our Ukrainian colleagues can ask us, can send us their requests, and if we can help anyway, we will be much more than happy. Thank you very much.
Thank you to Professor Kinkorova and conference for your work. Is for us good news. A lot of people and hospital and organization around Ukraine are so still active with the practical activity, not only for health but also for the simple citizens that want to stay in Czech Republic or after a period they want to come back to Ukraine. Are there some questions for Judita Kinkorova? Okay, we are not so many people, but
sorry, Gianni. I think is the experience of the Pilsen Hospital University of Judita is interesting as an example for us for this new network we want to create for helping the Odesa hospital and the other hospitals, of course, in Ukraine. Okay, we create a new a list of this hospital in order to give them some devices, in particular medical devices. We at the end of this morning we can create this network and to receive a list from Kyiv, from Odesa, a list of devices useful for your daily work.
Yes, thank you. And This is exactly our goal today, because this is a meeting we can also call expert people. Most of all, we are friends, and our goal is to spread all the needs that we receive today to all over the Europe. So it's not so important that today we are 1,000 or only 8. Each one in his country can be a testimonial to create the network that Francesco is asking, of course. So let me introduce Paolo Milia. He is a distinguished neurologist. He works in Umbria in a special institute for rehabilitation. He is one of the most expert in this field, and so it's a very pleasure to introduce him to give his speech. Please, Paolo.
Good morning. Thank you, Gianni, for your kind presentation, and thank you very much, Professor Francesco Sicurello, for this very interesting opportunity to give our approach and professional capability to our friends in Ukraine that are in this moment in a very quite difficulty. I'm really sorry that I cannot share with you my slides, but we have an internal problems with the Wi-Fi system and the software system. So I am in touch with all of you using my iPhone, but I want to give my warmest embrace to our friends from Odesa, from Ukraine, and offer with the ITeam system and from the University of Perugia and Prosperius Institutes our helps, especially to people who is suffering in this terrible war. I am a neurologist, and I am the chairman of the Neuroradiology and Robotic area in Prosperius. Prosperius is a big hospital in the small city of Umbertide in the middle of Italy. The region is Umbria. We are expertise, especially using technology, especially using exoskeletons. So we are expertise on gait training in patients affected by severe neurological disorders like stroke or spinal cord injuries, multiple sclerosis, and all the neurological diseases that are affecting the use of legs, arms. Our technology is working into different approaching times that are upper limb and lower limbs rehabilitation, but at the same time, we are developing the opportunities using telerehabilitation. I am the vice president of an important and very interesting society, the International Society of Digital Medicine. And using this society that is embracing about 144 places all around the world, we are developing this new opportunity that is offering now to this devastating war, using technology, using the digital approach to help people who is far from us. So in my country, we are working with the telerehabilitation, especially in patients affected by stroke, using serious game, these three-dimensional programs called Rehability. And I think that would be really interesting to offer the same opportunity to our friends in Ukraine and to help them to rehab people in a very difficult circumstances. So I'm inviting Francesco Sicurello and all the friends in Ukraine to leave and to give my, Francesco to give my email address so that we can help people, so that we can share, so that we can give us the opportunity to keep in touch with the society, to keep in touch with our hospital, and try to understand if we can give a real help to these people. In the next future, I'm inviting also the ITM society to help people, offering them the opportunity to come in Italy, especially people who are suffering now from a stroke in Ukraine that cannot be helped in a very, really a good way in terms of rehabilitation, and give them the opportunity to come, to be helped, to learn also technology, because we are working with different universities in the United States. And at the moment, I have 8 PT students coming from the Belmont University and University of Philadelphia. They are here to learn how to use an exoskeleton. They are here to use to learn how to use technology applied to neurological disorders. So I'm sincerely inviting you to keep in touch with us, because I think that this impressive society, the I-Team, the ITIM, can help all of you to increase your medical approach, but at the same time to increase the recovery approach using our opportunities. So I'm again sending you my warmest embrace. I'm saying ciao to Francesco, and please, I give you the opportunity to share my data, my emails, number, etc., and whatever we can do, it will be a great pleasure. Thank you very much.
Thank you, Paolo. Of course,
Thank you to Paolo.
Our colleagues accept this warm invite from you, and especially since you are expert in neurological disorders of the movement, and we can imagine during the war how this disease can affect a lot of people. So your experience will be very, very useful, and we are in touch with you. And thank you again for your speech and for your presence.
Thank you.
It's very important.
Grazie, Paolo.
Grazie, Paolo. Then we move to Professor Tetiana Shmelova. I hope to
Thank you.
The right pronunciation of your name. Professor Tetiana, we are very, very happy to have with us. So please give your presentation.
Thank you. I am from Ukraine, from Kyiv, from National Aviation University. And many thanks for invitation, Francesca and Salim Badik. Salim Badik, my colleagues and my friend from Egypt. And
me too. Me too.
You know Salim Badik. Now my presentation, because National Aviation University, this is a support too of medicine, because medicine assistance very important for us and for all people. But aviation, this is a transport. Aviation, this is a moving. And our report presentation about about our.
Okay.
Okay. You see? Oh.
Yes.
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 You see
nice.
My presentation about our department and navigation system and National Aviation University. This report was in medicine international conference, data-driven medicine, and my colleagues Alexander Sechka from Uzhhorod, we working together because aviation and medicine must be together in emergency too. And thank you for your report, for your support, our Ukraine in our difficult time, because very difficult time for us. And using, for example, drone, this is a new approach in aviation, unmanned vehicles, unmanned aircraft, drone, and how we may use drone in healthcare. No, a little about our department. We working together because I am professor in air navigation system department, and with me working my pupils, my big pupils and little pupils. This is our students. We have specialty operator of drones, IT technology, and flight dispatch, air traffic controller, and pilots too. And we working together in different areas, because now in aviation, many a lot important job. This is a collaborative decision making in difficult situation, in emergency situation too. And about drones, for example, and using in medicine. And what drones? Drone, this is a safe for using, because in our situation now, we have very big problem for delivery urgent and important medicine cargo. This is a big problem in this situation. And our research, our science research in this situation. This is a delivery important medicine cargo using mathematical model, decision making in uncertainty, and delivery with cargo using grid. We have area, we have landschaft, difficult landschaft, and delivery with cargo in different places, And about aviation support in difficult situation, and aviation problems too. We now know about shell model. Shell model, this is a communication between different areas, and reason model, this is an accident. No, I think you know about these models. And now we have collaborative decision-making models and using drone integrated airspace. And for example, last year was security culture in ICAO, International Civil Aviation Organization. And I think in this year will be year of understanding between foreign countries too. And about this conceptual model in aviation, from shell model and step by step for minimal error, minimal and maximum effect, and the minimal human factor problem. It's a step by step and chronological table. And security culture about last year, culture in communication between operators in one team. No, but in this year, I don't know about this. What year now, 2022. And about artificial intelligence, we many working with models and fabric models and artificial intelligence models. And we writing and publishing in USA, in Poland, in Germany, maybe in Italian too, because we have experience in building artificial intelligence system starting from expert system. Because experts all know about future artificial intelligence system. And our models, for example, in delivery urgent medical products, medical cargo, very important cargo, and quickly delivery. And for example, we have many participants in this process. This is a doctors, this is a transport, this is a logistic organization, but many opinions, many decisions, and after improving this model, we obtained rational decision. And this is on this slide, you can see these mathematical models and why we working together, because scientists from mathematics, scientists from informational technology, scientists from medicine, and we working together because this is a mathematics models. And on 4 steps, step number 4, we obtained optimal result for delivery medical cargo. And example medicine delivery with cargo from Uzhhorod to Khust, from Uzhhorod. This is many mountains and complex areas, but this example we obtained. And in this situation, we obtained optimal ways for drones for delivery cargo, minimal cost and maximum safe. And this is a task on this slide. And our decision on our department and diagnostic emotional state, and we had decision in these areas, diagnostic emotional state of participant and diagnostic emotional state of operator on job. On this slide, you can see. About our department, on our department, we are teaching, we teach for students, operator of drones, air traffic controller, pilots, and engineer who service with techniques. This is my diploma, this girl, this is my colleagues, air traffic controller. and our laboratory many informational technology service, and our students have practice in Belgium, and we are teaching in China, in Germany. No, this is our students on practice in Brussels, in Eurocontrol, and our international project and trip in China. This is our students, and I in China, Hangzhou, Chongqing, and our satellite laboratory. We have very modern satellite laboratory on our department because satellites with the connection, satellites with our connection in different situation. And my training, decision-making in risk, emergency, dynamic models, and our books. This is Ukraine, our books, and we published in USA and Poland. In Poland, this is decision-making in risk uncertainty in different areas, pilots, decision-making for air traffic controller, for operator of drones, many books. And now in medicine, last year published books, decision-making in medicines, collaborative decision-making for all participants in this process, difficult process. Thank you for attention.
Thank you. Thank you very much.
Thank you, Tetiana.
Thank you very much. We hope, of course, that this experience in this aviation fields could be useful also in this field, and you have acquired, I saw, a very big experience, and so also in medical field. So we hope that you can continue your excellent activity in this field to help your country. Of course, so we can move to the last speaker of this first section. Okay, so we move to Professor Clemente to finish the previous section, and then we will give the podium to Professor Godleski that asked also for a question, and then he can move for his speech. So, Professor Clemente.
Okay, thank you very much. Thank you very much, Chairman, Mr. Chairman Gianni Pellicanò, and thank you to Francesco for this very quick meeting and an empowerment meeting for us and from people, I hope for people from other countries, especially from Ukraine. So I'm sharing my my video. Did you see my video, my slides?
Yes.
Yes.
Okay, thank you very much. Okay, in the framework of this meeting, I'm presenting some products realized here in Italy, and with the idea to share with this know-how with people from other countries, and to establish collaboration between different nations, as said the first speaker today. And this is a history of telemedicine we know very well, starting from the telehealth in some way, using human people and transferring information from Greek time. This is a vision from in 1924, but now we're applying even with new technologies this program and this organization, this transfer of information. And we start from COVID, another emergency, because in this time really as from this colleague from University of Langone Hospital in New York, the practice of medicine has changed more in 1 week than in the previous 28 years. This is because we are introducing a lot of telemedicine products in the clinical practice, and now, especially in Italy, we have to give to enforce this program and to put in the health system in not in a self-made organization, but in a structured organization. This is done, as said Francesco, by all regional organizations in Italy. We have 21 different organizations, and even each region is organizing a platform of the organization, or this is more important, a reimbursement for this kind of activities. So, as you know, I'm very involved in Children's Hospital in Naples, and the first services that can be used in these in different normal and emergency time is a specialist teleconsultation from from a hub hospital to spoke points, in this case in the study in the labs of a medical doctor, of a territorial medical doctor, in this case pediatrics medical doctors operating on the territory, and using internet facilities from hub, that is a main hospital, to the spoke point. But the spoke point can be in our organization now, can be a pharmacy, can be a civil, any civil buildings on the territory. Now in the Regione Liguria, we are organizing this a spoke point into the municipality. So this is the flowchart, even in Italian, but is the flowchart of the activity that is important to implement, real implement this data into the regional informative system. And we are starting with some region, particularly in Liguria and in Campania, we're starting to implement this kind of flowchart and this kind of activity related to this flowchart. This is the data sheet and the final refers for the patients. Other projects are teleconsultation, specialist teleconsultation between different regions. In this case, we have two regions from from south of Italy, from the Campania region, and again, Hospital Santo Bono, and the local health unit of Potenza, that is the main city of Basilicata, in which there is a long-term an hospice for children, that it needs consultation, specialistic consultation from a specialistic hospital. This is another channel of communication between patients in life support ventilation, lung ventilation, and this other channel and other modality to connect the ventilator to the hub center, diagnosis center, through two channels, real data from a medical device and the data from tablet to be used by healthcare professionals, and between parents, caregivers, and medical doctors. These are the devices, and it's a short explanation of the activities. This is the control activated in this case. But what is this is another case of telerehabilitation, again from Santo Bono Basilicon physiatrists in this case, to the caregivers, through the caregivers to the patients. This is, again, it's important to establish a flowchart of notices of data to implement a good telemedicine service. So we want to have a lesson learned from this time that can be exported to this new emergency, to address an humanized approach in effort medical arts. This is a publication exposed, published in 2020, just in the full period of COVID. And the lesson learned in our case to this project is participation of clinicals, analysis of requirements, and motivate and communicate both medical doctor and patients, caregivers. And the project must be always improved during the activity. We have these slides, or this is a time of organization, but this is time of execution of the project, in which the Ishikawa run must be always in progress. Plan, do, checked, act. What another lesson learned is that even the technology is quite available. Legal aspect, privacy aspect, especially in Europe, are important. Administrative are solving, but the management, the organization, the identification of the flow, the identification of activities must be put in evidence before the design of the project. So, thank you to organizer for the effort of this conference. And if there are some questions, please.
Okay, thank you to Professor Clemente. And
I have a question.
Yes.
Please. I have a question about the organization of distance monitoring for patients.
Yeah.
Monitoring with monitoring part of time or constant monitoring, because we have research for monitoring of state of pilot in flight. Next step was about monitoring of in smart city, but very interesting in your presentation, in your report about monitoring for patients. Very interesting for us, because this is a decision making about state of participants, and constant monitoring using device, using distance service. What do you think about this constant monitoring? Because doctor may be busy, but patient on control, constant control.
Yes.
Monitoring.
Now, they really, speaking about our application, we are monitoring patients in life support ventilation. So the monitoring is the monitoring activities is from usual parameters in home in ventilation, in lung ventilation, are consulted by medical doctor. In this case, daily, once a day. But continuous monitoring is important, and in Italy we are thinking about some figures, paramedics people dedicated to this activity, because we are speaking, and in this perhaps Gianni Pellicanò can help me to form, to give to the health services medical personnel that is useful for with this communication and telecommunication system for, in this case, monitoring. It's very important. But the platform, I mean, are quite available in this moment. There are some automatic alarms, of course. Another question is, there are some automatic alarms that can be connected to messaging, signaling to medical doctor that can have a kind of advice in the pocket, and the medical doctor can be seen where the alarm is activated. There are different ways really to solve this problem, depending on the risk associated to the monitoring, of course.
Thank you. Very interesting approach for us to monitor.
Thank you very much for your question.
Okay, we stay in connection in order to create this network for Ukrainian support. Okay.
Okay, thank you very much.